Local doctors are now offering a new genetic test which can tell you how likely you are to lose your hair. Local 12 medical reporter Liz Bonus shows us how it works in today's Medical Edge. And we do want to caution you, this video does contain actual surgery.
By the time Mark Lucas decided he didn't want the top of his head to look like this anymore, his only real option was a hair transplant, much like this one. Dr. Jon Mendelsohn, a facial plastic surgeon, takes tiny strips of the hair from the back of the head to perform this transplant.
We dissect it into what we call microfollicular units. We make little paper cuts and we place it in the area, the recipient area where they're losing their hair.
This is Mark Lucas now. The transplant was so effective, he became Mendelsohn's clinical director of hair loss prevention and admits,
and my wife loves me with hair or without, but it's one of those things, I did it for me.
Lucas says he began losing his hair in high school, but he didn't know if he'd just have a receding hairline or go completely bald. This new genetic test for baldness changes that. Merrill Hodge, an ESPN sportscaster and a paid spokesperson for Mendelsohn, agreed to let us demonstrate how to perform the test and share his results. He says several men in his family have receding hairlines.
There's the creeping disease, as we call it, are they?
To perform the test, Mendelsohn used this kit from HairDx. It allows doctors to provide genetic testing information to patients through a simple cheek swab, which is sent away to a national laboratory for analysis.
They run what's called a genotype. They look at the DNA from the genes that they've evaluated that have to do with baldness.
If the probability comes back high, it means you have a good chance of losing much of your hair, which means you might want to consider treatment such as a hair transplant.
But this is just one of several options, and for many it may not be the first one if you find out through this genetic test that you're going bald.
You see, HairDx tests for a genetic variant found in more than 95% of bald men. But 6 out of 10 of those men will go bald before age 40, so early use of medical therapies might be a good way to start slowing down that process.
Things like Rogaine, Propecia, Luce, light-based therapies, or hair transplantation.
The good news for Hodge, he won't be needing these therapies. His probability of male pattern baldness came back low. With your Medical Edge, Liz Bonus, Local 12.
And the test costs $150. To find out more about it, you can call 513-651-HAIR. That's 4247. Or you can visit local12.com and click on the Medical Edge.
How are you feeling after seeing that?
You know, that's pleasant.
Sorry if you're getting ready to eat dinner. Ooh,
that was
bad.
Interesting at the very least.
But you did give us a nice warning.
Yes,
Yeah.
I tried.
That was good.
Okay.